Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about how one of the questions the interviewer may ask us during the interview. How did you handle a situation with a difficult or upset patient? So in this question, the interviewer want to see how can we handle this kind of a problem, which is commonly seen in the hospital or in the clinic. So in order to answer it, we need to know that this question belongs to the behavioral questions. So they want to observe us and they want to see if we can have a appropriate way to solve this problem. And and also the key is to know that why the patient get upset. So in order instead of just keep reassuring patient. So we need to know the reason behind that. We need to communicate with the patient and let the patient tell us why does he or her get upset. And once we know the reason, we will give the patient appropriate response in order to address their concerns. And we just try our best to reassure the patient at that time. And if it still doesn't work, so we may ask for help from our supervisor in order to show our teamwork. So actually, it's a pretty standard protocol to follow. Well, that's one exception. If you match to the psychiatry specialty, uh, I know there's a standard protocol for that specialty. So you need to you need to follow that instead of my suggestions. So here's my answer. Okay, so Dr. Cui, can you tell me how can you handle the situation that the patient gets upset? Oh yeah, so yeah, it's actually it's very common in the hospital and the clinic. So if the patient get upset, I would think about that. There must be a reason behind that. So I would talk to the patient to know what's their concern and to know why do they get upset in order to solve the problem. So if the patient can tell me the details, so I'll try my best to help them in order to address their concern. If I cannot help to some reason, if it's beyond my ability, so I will definitely ask my supervisor for help because we are a team. So I believe that this will definitely address most of this kind of a situation. So yeah, so you can see that in this answer, I actually covered almost all of these uh, key things, details, and I hope it's also helpful on your answer. And good luck.